Thank you very much. We now move to the Northern Territory, and I'm very pleased to introduce our two speakers who are online. First, Dr. Mark de Souza, who's an emergency specialist at the Royal Darwin Hospital, and he initiated the Sustainable Healthcare Committee for Northern Territory Health. And then Aunty Bilawara Lee is a senior elder of the Larrakai Nation of Darwin and a member of the Kabilo family. She wears many hats. She's very well known. She was recently recognised as the top-end NAIDOC Female Elder of the Year. Congratulations for that. And welcome to your presentation, which is about healthy patients, workforce and environment. Thank you.
Thanks for having us. We're dialing in from Larrakia country, where we've got a real-life present Larrakia elder, and we give our respects to the past and emerging leaders. So we've seen that policymakers need good data on financial emissions and emissions reductions in order to decarbonise healthcare. But in the next few minutes, what Aunty B and I would like to do is share our grassroots project at Royal Darwin Hospital, where the co-benefits are actually well-being and staff engagement and that of its community. This project, which we call the H3 project, was pitched to the health leadership in September last year in response to the exhaustion that healthcare workers were experiencing from prolonged COVID response, staff shortages, hospital overcrowding and workplace aggression. And these things have been going in health services all around Australia. And at the same time, I presented to them CAHA's Real Urgent Now paper, which conveyed the alarm and frustration that healthcare workers were feeling at the lack of organisational response to the health impacts of climate change. And critical incidents were really high, as were patient complaints, and staff morale was poor, especially for frontline ED workers, for example. And what became apparent was that Royal Darwin's precinct was failing to provide climate-adapted, COVID-safe outdoor areas. Instead, what they had was these sorts of landscapes. And staff were making use of whatever shade that was available in a campus that was rampant with the heat island effect. And can you imagine being a stressed healthcare worker trying to relax and recharge in this place, much less trying to maintain any passion for working in post-pandemic healthcare? And as this thermal imaging, courtesy of our colleague Steve Cook from CSIRO shows, pedestrians of all kinds were being exposed to surface temperatures in excess of 55 degrees as they tried to walk from a distant car park to a hospital entrance. And in fact, one mother I interviewed described this journey with her mobility impaired daughter as an SAS training exercise. And so the pitch was provide immediate psychological first aid to healthcare system at breaking point. And we do this by creating cool and restorative green spaces for all campus users, and thereby improve their well-being and provide adaptation to the projected warming situation in the wet tropics. We also wanted to engage and recruit healthcare workers to participate in climate actions in the workplace as projects emerged. And we believe that as we inform participants of the sustainability projects and how they can help, they're more likely to apply this literacy not only in the healthcare setting, but in their homes, through their social networks, the marketplace, and their electorates. And so we also wanted to campaign for the Health Leadership Committee to put climate adaptation and mitigation on cross-sectoral agendas within government. And after this, if this all worked, we would consider community engagement. And so our timelines looked like a series of phased campus greening projects to make use of rainfall coming into our wet season in December last year. We were going to use low-cost biophilic landscaping within the constraints of what we see as Royal Darwin's legacy infrastructure and pretty much absent funding. We would recruit champions through literacy building projects using new email systems, volunteer programs for gardening, develop intranet resources, and spruik at various staff forums. And we wanted our campus greening project to tessellate with another project that the Sustainable Healthcare Committee was designing, which was an active mobility program that would encourage staff to walk and ride to work and use green spaces to take their breaks and make them more restorative. We sought operational funding for these activities, and also called for the recruitment of the Territory's first health sustainability officer. And this was all endorsed in principle. They thought it was a great idea, but unfortunately no funding flowed. And so why is biophilia so important? As we've already heard from our Indigenous colleagues here, it's a very ancient concept, but it was coined in this term in the 60s, and in 40 years later became a complex hypothesis on designing the built hypothesis. And we all know at our heart that we have this innate human instinct to connect with nature and other living beings. There's a lot of evidence out there about the health benefits of green spaces in schools and workplaces, and increasing evidence of the benefits on health campuses. They promote stress reduction, they elevate our mood, hasten recovery, reduce the need for pain medication, and importantly for policymakers, they show greater satisfaction with the health service. I'm going to pass over to Aunty Bilawara, who's going to talk about how deeply embedded biophilia has been for Indigenous people.
Good afternoon, everyone. I am a recognised traditional healer, and for me, Western medical facilities is a foreign environment for First Nations peoples. It's cold and frightening. We have such a high population of people from very remote areas who are used to living quite differently from the built environment. So medical staff are trying to heal us up off Mother Earth, disconnected from Mother Nature, and we can't access our bush medicines. So this project with Mark is so important because it's going to make a big difference for the healing journey of our Aboriginal patients. As a healer, excuse me, access to our bush medicines is going to make my role a lot easier. So, you know, particularly like the ironwood tree, it is fundamentally critical for our smoking ceremonies. And the smoking ceremony is the first, always fundamental thing that we do when we're going to do a healing. And it doesn't matter whether you're coming through with your traditional healing or whether you're going through the Western medical system. The smoking ceremony is critically important. So this project I back completely, and I'll continue to work with Mark and my brothers and that who are very knowledgeable about the bush medicines are also engaged.
Thank you, Aunty B. Look, there's a lot of climate science that we know is ignored and cheekily used for its own purpose when it suits policymakers to spruik certain things and not others. But it's clear that a green climate adapted health precinct, it performs better. In Darwin, CSIRO shown that there's a 22°C reduction in land surface temperature achieved through shading, providing green trees and canopies for evapotranspiration and reflecting heat. It also increases active mobility so that you have improved outdoor thermal activity and engagement with active mobility. And of course, what better nature-based solution for carbon sequestration is there than trees? Climate adapted health precincts also make us feel better. Emergency staff are reporting the positive impact of this garden, which is at the rear entrance of the emergency department, which means they can attend it very quickly on a break. As little as 5 to 20 minutes of exposure to these sorts of gardens for healthcare workers is being shown to improve wellness and productivity. And frequent exposures are probably having a compounded restorative effect. Menzies researchers are also involved. They took great delight in planting this shady trellis on a barren built-in structure that was just sitting there unplanted. And also the medical students who are going to inherit the health workforce are getting engaged. They're really chuffed to know that the planting of flowering plants in this green wall, which you saw in the introductory slide, which is now in full flower, is increasing biodiversity. And the native bees, which produce sugar bag honey, which is really important for Indigenous people culturally and taste delicious, are being supported by the flowering plants. Our volunteers are aged between 3 and 70, and they provide, of course, a willing and free workforce. And since December 2021, we've had 450 trees, shrubs and grasses go in the ground, and these are almost exclusively top-end natives. And because we had no funding, the monies come from staff specialist donors, Hospital Wellbeing and Support Services Fund, from Rotary, and from individual members of the community through trees and goods like that. And a special shout out to our Director of Support Services, Mark McDonald, who really lives up to his title. It's really important that land care is cherished by these sorts of programs, and our volunteers achieve that. And caring for country is essentially land care. Our volunteers learn skills like how to use freely available hospital cardboard to mulch and suppress weeds instead of using Roundup. And land care is contributing to us overcoming environmental generational amnesia, where it becomes more and more normalized for environmental degradation to become the norm for each generation. And our working bees are also breaking down barriers. Here's our Director of Medical Services swinging a pick with medical students and members of the community. It allows community members to give back to the healthcare service, which they know has been struggling in the past 2 years. And here's an example of our hospital comms and Facebook page, which we're using to inform the workforce and recruit our volunteers, which number over 150. It's really important, as we said, that active mobility is targeted so that people are more encouraged to engage in those activities which allow us to be more physiologically adapted to a warming tropical climate. And we're also targeting footpaths which have been there for many years. This will be a shady, canopied area where people can walk through without becoming desiccated, and they can also linger. It's important that things like seating, water taps, and those sorts of structures can be put in to support people lingering. And it's not just about the clinical workers. This is an industrialized zone of the hospital where we planted some edible plants like rosellas. This is where support service staff like engineering and housekeeping congregate because it's near their area, and we want them to benefit from cool restorative green spaces as well. So finally, our next steps, there's so much to do, Aunty B.
Yeah.
We've got wet season coming up, so there's a plan for an Indigenous accommodation precinct to be planted out, again with some donated plants from a local enthusiast. Trilingual signage is a project in progress, and we've got an intranet resource package that we have stolen, as Ramsey said, off the Hunt in New England and adapted it to us. And it's time to keep pitching for operational commitment so it can stay with the volunteers engaging and adapting in therapeutic horticulture, as I've outlined, but we need this to become operationally funded. Thank you very much.